Snoring. It's a worldwide phenomenon with estimates of over 1 billion people who snore due to some sort of nasal or airway blockage. If you're looking for ways to curb snoring, a quick search on the internet will yield remedies such as nose clips and nasal strips. Quite frankly, these would fall within our expectations. But the search runs through the gamut to reveal slightly more bizarre results, such as singing and playing the didgeridoo, to anti-snore clothing and pillows. What this shows is the extent to which people will go to try to find a treatment. But the blight of this sleeping disorder is best summed up by the people who have to put up with our snoring. And these are the people that are closest to us. Their weapon of choice? Earplugs.
If you, like me, are a snorer, welcome to this installment of Chasing Sleep. Would you divorce your spouse for snoring? Drastic? Yes. Unheard of? No.
In this fourth installment of Chasing Sleep, I take my little snoring problem, usually confined behind bedroom doors, and throw it out into the open.
For this week's experiment, I call in on Dr. Ignatius Mark, who shows me parts of myself that even I have never seen before. But first up, Dr. Ong Tan Hao, a consultant at the Department of Respiratory and Critical Care Medicine, Singapore General Hospital, tells us everything we need to know about snoring, but we're too embarrassed to ask.
So Dr. Ong, exactly what causes snoring?
When you snore, it's because the air that comes in when you're breathing down your air passage, the air passage gets narrowed. There's a layer of soft tissue at the back of your throat called the soft palate. If the airway is narrowed, that will vibrate, and that causes this loud noise that we call snoring. So basically anything that causes narrowing of the airways. So in some of us, it's because your nose is blocked. Then you tend to open your mouth, and that accentuates the snoring. As you get older and there is more weight, more soft tissue around your neck, that causes narrowing of the passageway behind, and that can cause you to snore as well.
Oh, I see. So basically it's the nasal passages?
Not just the nasal passage, but when you breathe through your nose and it goes down to the back of your throat. So the nose is just the beginning of that passage.
Right.
Behind your tongue is actually another area that can narrow significantly.
Any blockage or obstruction?
From here to here.
So you're kind of flapping?
Not exactly flapping, but at the back of your throat, if there's narrowing, the soft palate will vibrate.
It seems to be a problem that my wife claims that I have. I seem to be snoring more and more, apparently.
In men who are middle-aged, up to 50% of them snore regularly.
So
it's very common.
I'm quite normal.
Yeah, it's very common. Snoring per se is actually not associated with increase in cardiovascular disease, in heart problems, or in stroke or high blood pressure. A lot of people come and tell me, oh, I'm snoring, will I die in my sleep? But if it's just simple snoring, it's actually not such a big problem. But among the group of heavy snorers, about 4% of middle-aged men have a condition called obstructive sleep apnea. What happens is, it's not just that the passageway narrows when you sleep. For instance, if you're quite fat, or if you have a very small jaw structure, the narrowing can be so severe that it obstructs completely. And when that happens, your blood oxygen levels can drop while you sleep, and it causes a disruption in your sleep. So this repeated drops in oxygen levels stresses your heart. It can cause you to have surges in blood pressure. They also cause the patient to be very tired. Very severe cases, I've had patients who fall asleep talking on the telephone, or when people come to visit Chinese New Year or Hari Raya.
Those who have OSA will definitely be snoring.
Oh yes, almost certainly.
Is there a remedy for OSA?
Certainly. In patients who are not as severe, or who have sleep apnea only in certain sleep postures, we treat conservatively. So basically we tell patients to lose weight if you can. So losing weight helps certainly, but of course it's very easy for me to say go lose weight, but many patients can't do that. Or if the sleep apnea is more severe, then you need to treat more aggressively. So you can start the patient on a mode of treatment that we call continuous positive airway pressure, or CPAP. It's like a reverse vacuum cleaner. So instead of sucking air, it blows air. And when you turn on the machine, it blows air to keep the airway propped open.
It's not pumping oxygen or anything?
No, it's not.
Okay.
It's not. There's multiple studies that show that when patients on CPAP, we abolish all the drops in oxygen levels. The sleep is much more consolidated. The disadvantage of a CPAP, of course, is that I do need you to put on a mask every night when you sleep. And as you can see from your expression, it's a rather alien idea to start with.
It's not very romantic as well.
Well, actually, no. The bed partners of patients with bad sleep apnea generally like the CPAP even more than the patient, because you don't snore.
Ah, yes.
Yeah, so the bed partner has the best sleep in years. The other way you can treat it, especially in a younger patient, is through various surgical procedures that can be done.
It sounds quite drastic to have to resort to surgery.
If the problem is a structural problem, for instance, we Chinese were actually born with rather small jaws. So there's a structural problem. So if you can overcome the structural problem, you can effectively cure the OSA. But of course, not every patient is suitable for surgery. If you speak to a surgeon, you will get a better idea.
So, on the one hand, there is primary snoring, which is snoring without cessation in breathing, and on the other, there is the more harmful obstructive sleep apnea, which ought to be taken care of.
So Matthew, I understand you've had some problems with your sleep.
Before I was diagnosed with sleep apnea this year, I just knew I would suddenly just drift off to sleep for an unknown reason. Sometimes when I'm driving, I'll just drift off. Something was wrong, I knew, but I couldn't pinpoint the exact reason. So I computer go into screensaver mode, suddenly just completely blank out, you don't know what's going on. It often feels that I haven't slept for a few years.
Really?
That kind of feeling, you just feel like you're dragging a corpse, a living corpse, like a zombie, and you keep yawning non-stop. I kept sleeping even during meetings, while driving, and that's very dangerous. And so I began to see it's life-threatening.
Obstructive sleep apnea can keep us awake at night and leave us to deal with excessive daytime sleepiness. How does one cope with the overwhelming need to sleep all the time at the workplace? This is the common room outside.
The history of humanity tells its story through the cultural artifacts it has left behind. From art to architecture, the physical manifestations of civilization's defining moments are all around us. Follow their trail across the world and discover the moments where civilization truly made its mark.
Everything we thought we knew about the world might turn out to be completely wrong. At the fundamental quantum level, reality is truly unknowable. Journey down the rabbit hole into the strange and the bizarre.
Our Earth, from a 10-ton tree to tiny bacteria, from the deepest oceans to the highest mountains, you, me, and every living thing on the planet have something in common. That thing is DNA. Unraveling the code has revealed the history of life on Earth. This is the wildlife we're used to seeing in Africa. But tragically, the once thousands of northern white rhino, hunted and poached almost to extinction, no longer wander its plains. Stephen Fry and Mark Kawadi team up to take 4 of the last remaining white rhinos in captivity and reintroduce them to their natural habitat. Is this their last hope? Last chance to see Return of the White Rhino.
The operating theatre in Mount Elizabeth Hospital. I'm waiting for Dr. Ignatius Mark. He is an ear, nose and throat surgeon and a certified sleep specialist.
He's also a self-confessed insomniac.
I don't think I want an operation. I don't think I like hospitals very much. I hope I don't have to operate. Just as my fear was about to lead me out of this place, something pulls me back.
Adrian? Dr. Mark?
Yes, hi.
Hi, good to meet you.
I've been expecting you.
Rick?
How can I help?
I don't want to know.
Maybe I can help you.
Excellent.
Let's walk.
Fantastic. Well, Dr. Mark, this is my sleep study.
Let's put this aside for a while.
Okay.
I need to find out what's bothering you. We need to interpret that together with the sleep study report.
I snore, apparently, and also during the daytime, I do feel drowsy.
Well, what you have described are two symptoms of obstructive sleep apnea. There are many symptoms. The common ones would be loud snoring and sleepiness in the day, which is what you have.
Okay.
Some other patients have poor sleep quality, sleep maintenance, insomnia, meaning they fall asleep and then they find it difficult to stay asleep. Some patients wake up in the morning with a headache. Prolonged sleep apnea, if untreated, will increase the risk of high blood pressure, heart disease, and strokes. Do you drink alcohol?
Yes, I do.
What alcohol does is it actually makes the walls of the upper airway more floppy. So it makes snoring and any obstructive sleep apnea worse. As part of the examination later, I'll need to take a look into your mouth and I'll need to look into your nose and throat with a special instrument called a nasal endoscope. Okay? So what I'll do now is I'll need to spray your nose with some local anesthetic. That will make the scope much more comfortable.
Promise?
Yes. Are you ready?
No, but go ahead.
Alright, just hold your breath. Alright, that's it.
Yay! Can I go home now?
Let's take a look at your sleep study report while you're waiting. The first thing you need to look at is how well you slept. You had about 17% deep sleep, 23% rapid eye movement sleep. Normally, that should be about 20 to 25%. So this is close to normal. And if we look at the chart on your sleep architecture, then you had about 4 cycles of sleep through the night. If we are worried about obstructive sleep apnea and snoring, what we need to look for is your breathing pattern. Are there any obstructions? And there are 3 types of obstructions that we look out for. The first is apneas. Apneas are total cessation of breathing, and the computer keeps track of that for us. The second type of breathing problems we look at is this thing called hypopnea. Hypopnea is a partial obstruction of breathing. What we look for is at least a 10-second duration of an apnea or hypopnea. Now, the third type of respiratory problem we look for is this thing called a RERA. That stands for respiratory effort-related arousal, meaning you're using a lot of energy to breathe in, to suck the air in through a narrow air passage. But because you're sleeping, you're not supposed to be working out. When you use extra energy to breathe, you wake yourself up. In your case, you had an apnea index of 0.1 per hour and a hypopnea index of 0. Your RERA index, though, was much higher, it's 5.7. You have very mild obstructive sleep apnea. Do you feel a lump in your throat? Okay, I think you're ready for the scope.
Ready? Oh, no lump.
Okay, before we do the scope, let me have a quick look into your mouth. So open up. Good. Just relax. All right, that's all. Are you ready for the scope now?
You've done this before, right?
Yes, I have.
Because I'm a scope virgin, so be gentle with me.
What's more important is that this is not my first time.
Oh goodness, here it comes.
Okay, now put your face naturally. Breathe slowly in and out. We're going into the nose towards the back of the nose here. Now, if you look at 9 o'clock, you see the little opening there? That's the opening to the eustachian tube that goes through the ears. This is the back of your nose. At this point, I would normally just screen to make sure you don't have any tumors growing here, and that looks clear. Okay? Now, I'm going to turn it down now. This is the back of your soft palate. You see that opening there? That is a little bit small, and that's why you are snoring. Okay, that opening should be bigger than the view that you can see. Now, as we go past that, this white thing here is the back of your tongue. And the white tissue there is actually skin. Just breathe slowly, close your mouth. Good. Now, as I go past the back of the tongue, this space here is also small. And you're probably also snoring due to vibrations at the back of the tongue. Beyond that, that V-shaped structure at the bottom that's moving, that's your voice box. Okay, good. It's moving well. Good. Coming out now. The nose is clean. I don't see any infection. Good. your airway is narrow at two main locations. The first is the back of your tongue, and the next is the back of your mouth. Okay, if you look at this model here, this is the nose, and that's where we went in through. This is your tongue here, your mouth, your lips, your teeth. So the first point of narrowing is this location here at the back of the soft palate. And the second location is the back of your tongue. Your tongue is further back than it should be. So what happens during sleep is that because all your muscles relax during sleep, this part here and this part here collapse. And the banging of the walls of this part of the airway generate noise that's called snoring. When the collapse is bad enough, you're actually choking yourself during sleep. You get apneas or hypopneas, but in your case, you just had one apnea the whole night. Most of the respiratory events, most of the problems that occurred for you was the airway being small, and that causes you to use a lot of effort to breathe, and you woke yourself up.
Right. Is it so narrow that something needs to be done to it?
Your problem is, on the sleep study, is very mild. And what I've seen on the scope is consistent with that finding.
Will it get worse as I age?
The only problem with age is that it causes the soft tissues here to be more floppy.
Okay.
So they collapse
just like everything else.
That's right. Well, I think in addition to the scope findings, I do see some signs that may suggest that you have a narrow airway by looking at your face.
Oh, really?
Yes. So if you look at the jaws, that actually creates the space inside for your airway. If it's narrow, that will mean that the air passage is narrow, and we can see that when we look at someone's face. So firstly, from the front, if your jaws are set further backwards, that means your tongue will be pushed back, the soft palate will be pushed further back as well, and your airway will be narrow. Other dimension that you can look for is the height of the jaw bones. So someone that has a very small jaw height will have a non-prominent angle of the jaw here.
Right.
Also relevant is the height here, because if you have a big jaw here, you can see that the proportions between the upper lip and the lower lip will be very different. So someone with a small lower lip has a high chance of having obstructive sleep apnea.
So what about me?
Yours doesn't look too bad. You do have a slight retrusion of both jaws, but other than that, I think the lower jaw is pretty typical for a Southern Chinese. We are different from Caucasians. The Caucasians have much larger jaws.
For example, someone like George Clooney, who's got this very manly jaw.
His jaw has good height, it's broad, and it's very far forward. So that is protective for obstructive sleep apnea.
And also makes him very handsome.
That's right.
So what do we do about my problem?
I think you should get some treatment. What I think you should do is to start some continuous positive airway pressure therapy. I will refer you to a technician called Nancy. She will help you get started on the CPAP.
So the doctor has prescribed to me something called a continuous positive airway pressure mask. Now, hopefully this will remedy my snoring.
Take a seat, Mr. Pan.
Right, so Nancy, these are your toys.
This will be your toys for today too.
How exciting.
Today we'll just go and try some of these masks for you, and to find out what kind of mask will be suitable for you. Let me just measure your nose. Probably around here.
Large and wide, am I?
Yeah, large and wide.
I like the sound of that, actually. Adrian, you're so large and wide.
Okay, I'm going to start the pressure now. You feel the air coming through, in and out through your nose. Just relax. All the masks have this little swivel thing, so you can just turn freely. So you don't have to worry about sleeping in one position the entire night. So we're going to go through next one we call a nasal pillow to your nostril.
One for each nostril.
Yes. You may feel the air is going in much stronger, but it actually is the same. It's just because it's going in directly to the nostrils.
This machine, for example, is it able to monitor the intake and then adjust itself?
There are a couple of types of machines. So one is a fixed pressure throughout. The other one is as a smart sensor. They will actually know how much obstruction that you have, and you adjust the pressure accordingly to suit your needs. It's very important to find something that you are, comfortable with and you'll be able to fall asleep in.
Kind of prevent you from talking, which
Yes.
my wife will be very happy about as well. Stops me snoring and stops me talking. So are there any side effects to using the CPAP?
No, the only thing is that you may like it so much that you want to use it every single day, because without it you don't sleep well.
So Nancy, I suppose I have to pick one of these to take home with me. I pick you!
All right. Hopefully you have, lots of good sleep with the machine.
Fingers crossed.
I've been going to bed with the continuous positive airway pressure mask, and I have to say it did take some getting used to, but I'm also happy to report that I've been sleeping restfully and snorelessly.
With that in the bag, I'm here at Parkway East Hospital for my 10 o'clock with Dr. Ignatius Mark. All right, Dr. Mark, I've given this new friend of mine, the CPAP, a try, and I feel I've had a good sleep in the night. And more significantly, my wife has also been getting much better sleep.
Yes. Now, were there any problems at all initially?
First couple of nights, I had to get used to actually having this contraption on. But once I got used to it, it just became just a natural thing to put it on.
Good. All right, should we take a look at the data from the machine?
Okay.
And let me get my staff to take this and print out the data for us. There are many different types of masks, and there's no one single best mask for everyone. But if you find that this is more comfortable and this fits well, that's more important, because then you'll be able to use the machine more optimally.
Hello.
Oh, thank you. Okay, let's have a look at your data. Now, this is how the machine has assessed your use. It tells us how much you've been using it every day. It tells us what pressures the machine needs to use to keep your airway open for you to breathe. It also tells us how much air leaks there are, if the mask is fitting well or not.
Right.
And it does a mini sleep study. We can use that to compare with before you started treatment.
In spite of the use of the CPAP, there might still be periods during my sleep where I actually involuntarily stop breathing.
Yes, and that sometimes is normal. So far your data looks pretty good. I think you should continue using this. This could be a permanent form of treatment for you.
Great.
Well, you don't look like you're very thrilled about using that for the rest of your life.
Well,
it's a very natural reaction, so there are other options available. First off, behavioral changes. If someone is overweight, losing weight will help. The other thing is alcohol consumption. So avoid alcohol if you find that it makes the sleep apnea or snoring worse. The other things are, if you have nasal obstruction, you should treat that. The last thing is sleeping position. When you sleep on the side, snoring tends to be softer as compared to when you're sleeping on your back. Surgery is also an option. There are only 3 reasons you should consider surgery. The first reason is if you have a simple type of obstruction, that with very simple surgery, I can give you a high chance of cure. The second reason for surgery is when there is upstream obstruction in the airway. For example, the nose is blocked, and if medication does not improve that, the nasal obstruction will interfere with CPAP use. If we do nasal surgery, we open up the front part of the air passage, you can go back to using your CPAP more effectively. So the second reason for surgery is to help with treatment, not so much to cure your problem.
Got it.
Now, the third reason for surgery is when you have tried and failed or rejected all the non-invasive treatment options. Then we do surgery as a last resort. And the reason for that is because surgery has risk. And surgery is not universally successful. We do fail occasionally with surgery, and the success rates depends on the type of surgery we do and the type of obstruction you have. Plus, surgery is irreversible.
Is there something that you would like people to be aware of about snoring and obstructive sleep apnea?
Yes, snoring is a very common problem, but you have to be aware that snoring may not be entirely benign. It suggests that the upper airway is narrow and collapsing during sleep. And if this occurs, it's called obstructive sleep apnea. And obstructive sleep apnea is a medical problem because it can disrupt sleep quality and affect the daytime functioning. And it can decrease the quality of life. More importantly, untreated obstructive sleep apnea increases the risk of high blood pressure, heart disease, strokes, and diabetes. So if you have any symptoms of obstructive sleep apnea, you should seek medical attention.
So don't take snoring lightly.
That's right.
My wife thinks that snoring is something that the world can do without. Would she divorce me on the grounds of snoring? Or maybe in a parallel universe she already has. Sorry. In this installment of Chasing Sleep, we've explored several innovative solutions to silence snoring. The solution can be as simple as changing your sleeping position, or propping your head up on the pillow, or sewing a tennis ball to the back of your pajamas. Snorers unite.